Hi, everybody. Biohacking Blondes here. We're so excited to see everyone today. We're very excited. We have a special guest. We have Dr. Leo Hart. Leo was born and raised in South Florida, where regular chiropractic care was part of his family's health routine. Lucky for you, especially during high school years as a two-sport
Yes.
athlete. Yeah. Inspired by the chiropractic philosophy of whole body wellness, he pursued a career in chiropractic medicine and graduated from Life University in 1998. A pivotal moment in his education came when a family member's illness was successfully treated through functional medicine, deepening his commitment to holistic care. Dr. Hart now brings over 20 years of experience, continually learning and applying the latest cutting-edge therapies. His practice is dedicated to offering innovative, effective treatments that promote overall health and well-being. Welcome, Dr. Leo. So nice to have you.
Thank you guys so much. Happy to be here.
Yes, it's
We're,
wonderful.
we're thrilled. Tell us a little bit about your practice and how you got started.
Well, so as you know, it said in the bio, I grew up going to the chiropractor. That was part of what we did as kids. I played football, I played soccer, and I kind of knew I wanted to have a career in healthcare. And I really just love that philosophy of let's help people optimize their health. Let's treat the whole person and have them be at their greatest potential. And so that was kind of my ideal going into it, was I really wanted to help healthy people stay healthy. And I really took an interest in pediatrics, which I know we're going to talk about. So that was something I really focused on when I was in school. And then my sister got sick and she was diagnosed with Crohn's disease.
Mm-hmm.
And so my first introduction to a functional medicine practitioner through one of my professors, I actually convinced my sister to travel to Atlanta and be treated by him, and saw her get well. And really, she was only given one other option, which was a fairly large bowel resection and a lifetime of immunosuppressant medication. So
Oh,
I
yeah.
decided that, oh, that's something that I would like to incorporate. And, early on in my career, you just find that people are coming in for one reason, but they have all kinds of comorbidities. And, trying to kind of build a community of other practitioners or other physicians. And of course, we're going back now 26 years where functional medicine was really kind of in its infancy,
Mm-hmm.
and really not finding the support system was present outside of our office for these people. So I just decided, well, I guess it's going to be up to me. And I started incorporating that and started getting into functional diagnostic testing and nutraceutical interventions and nutrigenomics, as it was taught by Jeffrey Bland. That was really kind of a formative part of my education with him, and kind of got into doing a lot of functional medicine very early on in my career. And kind of our latest evolution, in 2016, I've always treated a lot of families, a lot of kids, and parents with children with neurodevelopmental issues, whether it's autistic kids or kids with ADD. I was kind of adding the functional medicine piece to their healthcare, but kind of knew that there was something missing. And I was familiar with the idea of functional neurology, but my general concept of functional neurology was more about TBI treatment, concussion management, stroke recovery, vestibular therapies, those kinds of things. And I didn't really see how that fit in. And then another friend of mine who's a chiropractor introduced me to this book called Disconnected Kids, which was written by Dr. Robert Melillo. And finding out that he would be teaching a functional neurology fellowship program that was focused more on childhood neurodevelopmental disorders. And I said, well, that sounds interesting. So let me check that out. And so I decided to sign up for kind of module one of a 3-year program, a fellowship program, to see if this was something I could easily or incorporate it all into an already busy practice. And I really just had a revelation that this was kind of the missing link, particularly dealing with the pediatric population, because as most of us know, this, problem of neurodevelopmental disorders in kids, it's just something that is mushrooming probably into, I believe it's the single greatest health challenge facing our population, when you have, 1 in 5 children with a learning disability. You have 1 in 9 children being diagnosed with ADHD or ADD, and 1 in 37 now being diagnosed with autism spectrum disorder. It's just this exponential surge in these diagnoses, and parents are just lost. They don't know what to do. And so, since 2018, I think we launched our program in 2019, our actual neuro rehab program, and I completed my fellowship in 2021. And now that's really been the evolution of the practice, which we've created a whole separate part of the practice, which is our neuro rehab division, and we call that brain space.
That's wonderful. That's wonderful.
Yeah.
And so you treat mainly children in the brain space, or
Well, it's funny is that we look at everything through kind of a developmental model, and we can dive into that a little bit. But the developmental of neurology really applies to all neurological conditions, not just developmental issues, but you can apply the same logic to traumatic brain injury or concussion, to stroke recovery, to adults with dysautonomia, to vestibular issues. There's some differing thoughts in the functional neurology world, but I believe that the developmental model, or just having a developmental perspective on functional neurology, really assists with all those types of cases. So we do focus on kids, but we also see a lot of traumatic brain injuries or concussions, and that's among young athletes, but also amongst people who've fell down and hit their heads or been in car accidents. We try not to focus on the injury aspect too much, but they wind up coming here because they find our website and it says that we treat concussions, and so we see a lot of that, and a lot of adults with dysautonomia. Lots of people are stressed out. Lots of people have been generally not as healthy as they should be when they get into this chronic stress environment, and they wind up calling us because they can't get out of bed. So,
and do you, I mean, this is a little off protocol, but do you have any theses or why there's such an increase in children with all these different disorders, the ADHD and the autism? What is
I don't think it's a theory anymore. I think it's very well understood that it is environmental. It's the environment has changed so much. I don't think you can pinpoint any one thing, but it definitely has to do with toxic burden. It definitely has to do with maternal stress. Those are probably the two main factors. And as far as in the scientific community, those things have been researched kind of piecemeal. And I think there is some consensus that it's something. You just can't say it's any one thing.
Right. It's a combination of a lot of things.
It's a combination of a lot of things. Yes.
Yeah.
So what, as far as toxic burden is concerned, what do we think are some of the main issues with that? Pesticides, that.
Well, we definitely know forever chemicals.
Yeah.
So whether that's pesticides or VOCs, I mean, it's ambivalent. It's everywhere in the environment now. And so it's almost impossible to not be exposed to metals, to VOCs, to herbicides and pesticides, and, xenoestrogens. There was a study that came out, I believe it was 11 heads of CDCs from around the world. This was in 2022, that they took a position that Tylenol was altering fetal brain development. So this went back to my early training, was that, if you have back pain when you're pregnant and you're not under chiropractic care, well, what do you take to alleviate your pain? What was recommended as safe? Tylenol. Now they've kind of updated that thought to say, we're not really sure about in utero, but for sure in the first 2 years of life, Tylenol is neurotoxic to children and alters brain development.
Meanwhile, that's what all they tell you to give your baby when they're teething, and
right, absolutely. And now the latest study had to do with eicosanoids, which are products from seed oils. So I mean, this goes back to just maternal diet, and then of course how maternal diet drives the development of the microbiome in the child. So biomic science is kind of tied in with all of this.
Mhm.
And that was the thought,
Absolutely.
is like, does autism start in the gut? Well, it doesn't start in the gut, but the gut is almost always involved.
Yeah.
So one of my best friends, Marika, her daughter is autistic, and they tested her gut with this very famous person in Australia. And it turned out that she has a 65% normal gut and 35% autistic gut, is what they call it.
Hmm.
And they test 2,000 different markers. And then what they do is they add what is missing. So, for example, her daughter has to now be taking E. coli. So that's
Okay.
one that she's missing.
Yeah.
And apparently this person in Australia has had such an enormous success with children that don't even speak, to then actually becoming, speaking and stuff, just by substituting and adding what they're lacking in their gut.
Mm.
Right.
Quite interesting, right?
Yeah.
I think that that's probably a subset of the autistic population, and we see that in our clinic, children who have had a regression, or their neurodevelopment is altered after birth as opposed to epigenetically in the womb. And a lot of times those are things, they can't latch, they can't feed, which
Right.
again, that went back to my early training in craniopathy, that why can't a baby latch? 90% of the time, the issue is with the baby. And usually it's a subtle strain of the cranial structure that's inhibiting the rooting reflex. So their latch isn't thorough. There might be a tether that's not being picked up. So they have a tethered oral tissue. And then, because of how our childbirth system works now, they said, well, breastfeeding just wasn't for you. And right away, that child will be at a disadvantage neurodevelopmentally. We know that, again, amongst all these different species, and when you say 2,000 markers, I'd imagine you mean all of the different subspecies of
Yes.
bacterium that are present
Yes.
in the microbiome. I've seen some of these tests where I don't even know the names of most of these
Correct.
species of bacteria that they're testing for, down to that species level. But we do know that certain key species of the microbiome actually drive glial cell development in the brain.
Mm.
And so, again, back to your original point, I believe there's a subset of autistic children who their autism is primarily driven by neuroinflammation.
Mm-hmm.
So if you're not addressing the root cause of the neuroinflammatory response, then yeah, you're not going to get very far.
Right. No, I can. What's your take on this whole, children's screens, video games, being on the phone, the different apps, the TikToks? That has a huge impact on these conditions, right? I mean, what do you tell your patients?
Well, they definitely need to limit screen time. I think there's enough data out there that it's not good for them, and whether it's the regulation of the behavior, specifically certain networks of the brain that are being overactivated. So you start to get this discrepancy, and that's really our primary model, is looking at network connectivity of the brain, primarily between the left and right hemispheres. So some of it is driven by repetitive eye movements. Some of it is driven by the lack of the eye movements that they need, eye movement patterns that they need to develop, not looking at it at a screen, but out in the environment, catching balls and running around and riding bikes, and things that we did when we were kids that they're generally doing less of.
Yeah.
So there's definitely, from a neurological perspective, there's definitely something to do with that, with the eye movement patterns. We know that for teenagers specifically, that vertical eye movements are primarily a dopaminergic activity. So those neurons that you use in vertical eye movement patterns are driven by dopamine.
Mm.
So that's why they get addicted to scrolling
Scrolling.
through socials,
Right.
because it's vertical eye movement in particular that overstimulates the dopaminergic pathways. So they're basically getting a dopamine rush, which is why when they put the phone down, they're like zombies. They don't want to do
Right.
anything,
Yeah.
right? Because they
I
just
noticed
got their dopamine
I
surge.
know I noticed too they get cranky. Like
Absolutely.
there's like a strain, like if you turn off a screen, like my daughter she has like a crankiness about her that I'm like, what happened to you? You were happy and then watch that show. watch that show for
Yeah.
20 minutes and now you're so cranky. And I'm like, what's happened? It's
Yeah.
like, that's it. Cause you're
Yeah.
depressed now that the show had to go away and now you're gotta
Right.
like with life or whatever.
Right.
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 Actually, my daughter's going to a new school and at the school they make a big thing about no screens ever at the school.
Right.
Very,
Yeah.
very crunchy granola school, but they were like, there's not a single screen in this whole element, you know, it only goes
Mhm.
until 6th grade, but there isn't a single
Yeah.
screen, which is
Yeah.
pretty
Amazing. Should be
But
like
we
that
have-
in every school.
yeah.
Absolutely. But we have
Right.
a rule here that if we have children who have major behavioral regulation issues, so they're, you know, kids that are prone to temper tantrums, or we make sure that they haven't had any screen time for 2 hours before they come in.
Right.
Because we've just had enough cases where those kids are being soothed in the car with the screen, and then they're coming in for therapy and they're overstimulated and they're just not going to do it. They have a meltdown.
Yep. Yeah. Makes sense.
So you
Oh.
know, it's a difficult thing to navigate in society these days, but
Oh.
it definitely needs to be limited.
Yeah. What would you do if someone, you know, like I'm thinking about a lot of my daughter's friends and their parents, like who they have kids with ADD. What would you do if a mother came to you with their child and said, I have this, my child has ADD. What can you do for me? What
Right.
kind of services do you offer for that?
So again, what we know from, and I think that the science and the research is very robust in this area, that ADD, ADHD, OCD, ODD, all autistic spectrum disorders, they share certain characteristics in terms of which parts of the brain or which networks of the brain are underdeveloped, underregulated, and underconnected. And in fact, Dr. Melillo, he coined a term called functional disconnection syndrome to describe this phenomenon, because it's, again, the research is so robust, which shows that there's generally in those cases an underdevelopment of certain networks of the right brain. And those networks of the right brain have to deal with focused attention, with executive function, with certain patterns of eye movement, with certain aspects of emotional regulation. So, you know, all of our therapy is really driven in this hemispheric model where we find specifically and the body will tell us that, right? Through assessment, we'll see deficits in cerebellar function. So they don't really have great balance. They don't really have great gross motor function. Generally, they've missed milestones. They don't track well with their eyes. And we also find, and this is really the foundation of what we do, is that they have retained primitive reflexes. So the whole concept of retained primitive reflexes as something that you can measure definitively in a child with ADHD, and to integrate those primitive reflexes as they should have been in the first 2 years of life, actually enables the connectivity of the brain to progress as it should have much earlier. So you're kind of leveraging neuroplasticity through different types of stimulation. We're using physical stimulation like vibration, touch, pressure. We're using patterns of movement. We're using patterns of eye movement. We're using sensory stimulation through smell, taste. And then we drive everything to the appropriate side of the brain that's underconnected. Because generally there's a lateralization of function. We can usually see that, okay, this is a right brain deficit or it's a left brain deficit, and you can drive information to that side specifically, and then the body's intelligence kind of takes over from there.
So I know from my friend Marika, again, her daughter is 14. They went up to Boston and they had this guy. Basically, her daughter never crawled, right? So now she's crawling every day. So
Right.
that's one of the things, because it's the development of the pons, she says, that never happened. And this is
Right.
important, right? So she's kind of
Yeah.
going back,
You
right?
have to go back through the steps. Yeah.
Right.
Like
So
a child that never crawled, you know, and those, so when we talk to parents about, okay, let's go back into the early childhood history, we'll find that there are missed milestones. Child walked early, they walked late, they skipped crawling, they crawled asymmetrically. They've always been a little goofy, like they have a hard time catching a ball. They have a
So,
hard time tracking. They're slow with their reading. Usually that's when they pick it up, unless it's a more severe, like a nonverbalism.
so
Um,
my son is 14 now, right? He never crawled. He scooted. And at that time, I had no idea, right? Because I wasn't on this path of health and wellness that I am now. Like now, that would, ring a bell. But he always scooted with his leg like this, right? And he
mhm.
would like shoot off, right? He was really good at that. But again, he never crawled. So what would you say? I don't think my son is I don't think, I mean, he has no problems, let's put it that way. So, but what would you say? Like,
I mean, it depends. You have to dig a little bit deeper, because
right? So maybe he has.
there's always things that you can measure, that there might be some functional deficit somewhere,
Ah,
and
okay.
that's what we see sometimes with super highly functioning kids with ADHD.
Ah,
Again, there's enough, I think, research to support this, that particularly in the left right brain discussion, that because your left brain, and most people have a fundamental idea of left versus right. Left is your kind of linear, logical, fine motor skills. There's a lot more to it than that. The right side is more your big picture thinking, your creative thought, nonverbal communication on the right side, verbal communication on the left side. Um, that there's subtle things that you can pick up on, because those patterns, it's an example of negative neuroplasticity, that those faulty patterns, whether they're faulty patterns of movement, they perpetuate throughout life. um,
wow.
but generally kids that have, if you're seeing a highly functioning kid, sometimes what you're seeing is a really strong left brain.
Mm.
So it's not necessarily a deficit as much as it's still an unevenness of function, but those kids tend to have genius tendencies. But we're
Right.
Yeah,
putting them
he's
in this
very
box,
smart.
like you can't sit still, you can't pay attention, so we're going to medicate you to make you calm, is
Right.
total insanity.
It's insane.
I
It's
mean,
insane.
there are
Yeah,
third graders who I know who are on
yeah,
Adderall already.
right.
And to me, that's, it's
There's
just,
kinder there's kindergartners on Adderall.
Oh,
but
oh
Yeah,
goodness.
and it makes them lose so much weight. My daughter has a friend, she lost like 13 pounds. I mean, she's already teeny to begin with. And
no,
it's a struggle. It's a bit of a
yeah.
struggle.
I
I
mean,
think though that those parents don't know where to go. That's the other problem, you know.
right. Yeah, no,
Now
they
they
don't know
do.
where to go. They
Now
don't
they
know
Now
do.
they
where to
do.
go. Yeah.
Right?
Exactly.
So,
It's
so you
becoming
have
aware.
these kids that are truly, they're gifted, but because we're putting them into a box,
Right.
and they're never reaching their full potential. So, one of the key things that I always communicate to parents, especially when it's a really highly functioning child, is that and it's an attentional problem specifically that we're dealing with. So they don't have other of the traits of like an autistic child, who doesn't really have social connection, who you know doesn't really have any way of interacting with the world. Those are hallmark signs of autism. So we're really talking about kids with ADD and ADHD, that really it's just their attentional networks are underdeveloped. I always try to tell them, look, we're not going to emphasize that there's a problem. The way I describe it to the child is, look, you were given a race car engine for a brain, but you have bicycle brakes. And so
Yeah.
everything we do is basically to try to train your brakes to make them stronger.
Yeah.
So it's not that there's anything wrong with you. It's that we're just going to take things that you're not as good at and make them not so bad, so that you are kind of a little bit more balanced out. That's the real premise of brain balancing in general.
hmm
So,
And usually, how long are your programs? When you see patients that are, let's say moderately ADHD, how long are your program? Like, what could it look like?
we have patients that have traveled from out of state, and so sometimes those patients, well, let's say from our most severe cases that we've seen in our clinic, we've had some that have stayed here for a month. We've had some that have stayed here for 6 weeks. The longest we had a patient here was for 2 months, and we're actually doing therapy sometimes for 3 or 4 hours a day. So
Wow.
it could be an hour or two in the morning, an hour or two in the afternoon. Our
Mhm.
local families, usually we'll see them for, every day of the week. So 5 days a week for 1 or 2 weeks. And at that point, we've kind of ignited neuroplasticity to enough of a degree that we can then transfer some of what we're doing into a home environment. So home care is a really important part of what we do. In our moderate cases, sometimes that's really where the ABA people or like an OT can step in and kind of support that if the parent is having a hard time kind of getting it done, because it can be 30 to 60 minutes a day of home care that we're still driving that stimulation to drive neuroplasticity. So usually our care in our office for our local patients will be, a couple of months at a time. And then depending on how much functionality, depending on the amount of change that's happened, we may have them go back to school, work with their other team, whether it's speech therapy or occupational therapy, to work on the fine details that really, when you have reflexes that haven't been integrated, when you have major functional hemispheric deficits, trying to work on frontal lobe activities is really can be pretty ineffective. So a lot of times it's kind of like babysitting, or it's kind of like, let's help you just manage the situation as it is, where we're actually trying to drive meaningful change. And those changes, they perpetuate into the future. So for some kids, it's a really long process. When we have our more severe kind of nonverbal autistic kids that come in, sometimes we work with them, 2 or 3 weeks of the year, or 3 to 6 weeks of the year for a couple of years to really see major changes. Some of them become verbal, some of them it's really slow, and they become really good at nonverbal communication, where before they have no communication. So, it varies from case to case, and there's definitely a continuum of complexity for sure.
And on the topic of neuroplasticity, what is such a hot topic in our world, Molly's and mine, biohackers, what do you recommend for anyone out there listening to this to help with their neuroplasticity? So people like
so like you or me, reduce inflammation for sure.
Right.
When the body's on fire, you're not going to make a lot of changes. So, that's a broad subject.
Yeah.
Right.
Right.
We talk about that's a really big to-do list.
Yeah.
Yeah. And then, the idea with neuroplasticity, there's 3 basic tenets, and we say it's frequency, duration, and intensity. So you have to make sure that, it's like any good habit. They say it was like 45 days to create a new habit, or 6 weeks.
Yeah.
So, it takes some time and dedication if you're really trying to make a change. So you have to be persistent with it, and then find the right tools that are addressing your particular deficits. So whatever that, as far as the intensity goes, I mean, we always tell patients that, like, that's what we can create in our clinic is an adequate amount of intensity to drive those changes. So, we're using photobiomodulation, we're using whole body vibration, we're using, pulsed frequency nerves, peripheral nerve stimulation. We're using all these modalities to make the stimulation intense enough for it to be meaningful.
So on that topic, you've got Centropix, PMA. I know that. I'm a big fan myself. I have it myself. Then you have the NanoVi, right? And you got the BrainTap.
Yes.
So those 3 things, Molly and I, we love them, right?
Yeah.
They are.
So we bundle all those 3 modalities together, and we're really using it for again, probably more for our wellness patients as a stress reduction. And that's the other thing as far as neuroplasticity goes. I mean, really, I think most adults are dealing more with reducing negative neuroplasticity than they are promoting positive neuroplasticity.
Right.
Okay. Yeah.
So, it's all about reducing stress, correcting the dysregulated stress response. I mean, we really know that the neurobiological basis of life has to do with our parasympathetic nervous system. So people are stressed out, and how do you get them out of fight or flight? That's probably the number one thing you can do for your health is, find the tools that work for you to get your body out of this chronic unregulated stress response.
And do you think that stacking those three modalities, I mean, NanoVi is for obviously misfolded proteins, right?
Mhm,
You're stacking that with the other two, the Centropix and the BrainTap.
mhm.
And tell the audience a little bit about it and why you're stacking it that way.
So we feel like there's a synergistic effect at the cellular level.
Mhm.
So, the brain tap is kind of working more on the cognitive end of things, but I don't know if your listeners know about brain tap, and the specific types of auditory frequencies that they're using are really to kind of normalize our brainwave activity. It's a great tool, actually.
Yeah.
Um,
Yes.
so one aspect of it is more neurological, the other two are more targeted towards cellular health. And I just feel that those three things together are totally synergistic.
I agree. Have you seen great results with it?
So for example, if we have a POTS case, so we see a lot of patients with POTS. I don't know if you guys are familiar with POTS. It's
That's
kind of the
become
one of the things that we've gotten really, really good at treating is, and some of the stories are honestly heartbreaking of where these patients have been and what they've done and what they've tried, and um, let's say the level of care that they've received, where on a medical side where they're saying, well, we don't know what else to do with you, good luck. That's where these folks wind up. So when we do, it's become a big part of our program, is doing vagus nerve rehabilitation. So prior to that kind of bundle of three things, we have a whole protocol that we go through to reactivate the vagus nerve or the vagal system or the polyvagal system, engage the parasympathetic nervous system, and then they basically have 30 minutes to go and just recharge in what we call the brain spa. So there's a lot more to vagus nerve rehabilitation, if we want to call it that. But we know that that's really the root of it, is that the parasympathetic nervous system is just completely exhausted or is minimally online in their body. And that's reflected in their gut, it's reflected in their sleep cycles, it's reflected in their inability to regulate feelings of anxiety or depression. And that's really where we begin. Even before we get into doing anything hemispherically with them, we feel like we have to get the parasympathetic nervous system back online. And that applies to the kids as well.
Wow.
Most kids that are autistic or are ADHD are also, they've been living their whole life in fight or flight.
Mhm.
So getting them out of that mode, again, it's another analogy of teaching the body how to reapply the brake pedal is one of the most powerful things that you could do. And
That's,
there's things that you can do at home, and we teach people how to do that as well.
do you guys do supplements there too for that? Like
We
adrenal
do
supplements and all of that stuff too? Okay,
all
great.
that stuff too.
Yeah,
Yep.
because I think like that stack on top of just like some adrenal support and some like L-theanine and
Oh
a
yeah.
things is like
Well,
you'll be
well,
resting.
like I said, that was more my background in functional medicine. And so,
Yeah.
dealing with the metabolic aspects, of course, that's everybody has a metabolic assessment as well.
Mhm.
And we layered that in from day one,
Oh, that's amazing. Okay.
depending where they're at and what they need. Yeah.
So when
So
it
it,
comes to you, they go through a series of testing first. Is that how it works? Like they come in, they do some testing, and then you kind of assign different modalities.
Correct. We try to decide, what are the most appropriate tests if they need to have blood, stool, saliva, urine, whatever it might be. What's appropriate for them? What have they already had done? We take what's already been done and kind of incorporate that if it's relevant. And then of course we just run them through our physical assessment, which is neurologically based. So we do some eye tracking, we do balance testing, we do HRV testing, and then we do a full neurological exam physically.
what about heavy metals and molds? Does that come into your testing too?
We ask everyone about the potential for mold exposure. Mold is bad for sure. So yes, when those things come up in the history, and that's something that um, depending on where you did your functional medicine training, and I know Molly did at FDN, it's really right. The detective work is like, where have you been? What have you been exposed to? Like your history tells you everything. And I feel like that's what's really lacking, especially in medicine, because depending on what specialty you're in, you're only taking a limited history. You're only looking at a little piece of the history. And so, you know, if you're, it's a skill, right? That you have to become a skilled history
Detective.
taker. And if you take
Yeah.
if you take a good history, then it'll clue you as to what you need to look at.
Oh,
And
yeah.
then sometimes there's clues along the way that open up other discussions. I give
Yeah.
you a good example. I had a brother and a sister, 11 and 13, came to see us, both dyslexic. Okay. And so mom inquired about the functional neurology program. Yes, we see dyslexic kids. And so she brings them in. And after about 4 days working with them, we're having like very little effect. So I said, okay, well, there's something else going on. And in the history, both kids had natural childbirth. They were breastfed till they were 2. They've never had an antibiotic their whole life. They've never had a vaccine their whole life. I
Wow.
mean, they've had a very clean childhood, healthy, loving home. So what's going on? Well, so we come to find out both kids from about the time they were 3 or 4 years old, have been doing gymnastics. In fact, the 13-year-old, the girl of the brother and sister, was a really high level gymnast. And, you know, in our history, we're finding out not only is she a gymnast, but she's got a lot of pain. I mean, gymnasts in general hurt their bodies a lot. So she's, you know, got pain all over her body. There's some other things going on, but didn't seem to be much going on metabolically. And so I said, something else is going on. And 2 weeks later, the mom came to me. She said, I think we figured out what's going on. They actually condemned this gymnastics facility because it had black mold everywhere.
Oh,
Black mold in the foam pit, black mold under the mats,
my goodness.
black mold everywhere
Oh
in
my
this
goodness.
gym. And I said, well, your kids have a mold issue. So we ran mold mycotoxin testing, and I mean, they were full of mold,
oh,
off the charts with mold toxin. So,
Oh
you know,
goodness.
again, it's very hard to rehabilitate a brain that's on fire.
yeah.
Of course.
And mold, you know, it compromises the blood-brain barrier. We know certain, it's interesting because the girl actually, she also had a very low affect. She was very expressionless. She was very low tone. And what we know is certain mold toxins actually bind to dopamine receptors in the brain. And you actually wind up with a dopamine receptor autoimmunity.
Oh, wow.
So that's a novel test. I don't know if you're familiar with the Neuralzoomer Plus, Molly.
No, I didn't know that one. That sounds
So
amazing.
Vibrant Wellness does a test called the Neuralzoomer Plus, and one of the markers that it looks at is receptor-specific antigen antibody reactions. And so we know that if there's been a mold exposure and the patient has high levels of ochratoxin A, that ochratoxin A will actually trigger a dopamine receptor autoimmunity, which is what was going on with this girl.
Then she's just like blank face.
She's like blank face. Yeah.
Oh.
And there's a little bit more complexity to it, like which dopamine receptors being affected. Is it D1 or D2? Is it affecting more the left or the right pathway, or the left or right dominant pathway? So there's you know, all those things to consider, but we just paused our therapy. I'm like, I can't treat this child when they're like that. And we've seen that happen. We've had a couple of patients like that where we won't treat them. I've had parents bringing their kids in, and you know, we've had a couple of pandas cases, and they've done nothing. And I said, we're not going to do any brain work until you get this under control a little bit. That's just how I personally do it. I know some other people who are doing similar things, they kind of dive right into it. I just feel like we're not as effective as we should be when there's such a high level of inflammation. So we'll sometimes we'll send the patients home for, you know, a month and have them just try to begin to get this under control before we do anything. And that's what me personally, what I found in my practice is most effective.
Do you detox the mold there too, or do you send them somewhere else? Like, do you give them, you know, candida?
You mean like for with chelation?
Or yeah, in any capacity. At
I mean,
FDA we do like a biocidin, with a binder and some mycopol and a handful of supplements that can help flush things out.
all that stuff. I mean, I'm a really big fan of Cellcore Biosciences. So I don't know if you know about Cellcore. I really like their binder program.
Mhm.
If there's mold exposure, what's super important is they have to flush out the sinuses. Mold loves to hide in the sinuses, so nasal and oral dysbiosis become a factor as well.
Yeah.
So everyone that has mold issues, we send them home with a nasal rinse with a binder.
Smart.
Mm.
Yep.
The binders are really good. I mean, I know that there's more intense types of mold detoxes that are out there. There's a Shoemaker protocol, which, I mean, I know that there's a bit of research behind that. To me, it seems really harsh and extreme.
Mhm.
Which
But I
one
know
is that?
patients,
What is
that's
that?
that's a medical mycotoxin detoxification protocol where they're using, again, my surface understanding, they're using statin drugs. So they're using the body's own cholesterol as a binder.
Oh, wow.
Interesting.
So yeah, so
Interesting.
as you're kind of mobilizing cholesterol out of the body, it's pulling the mycotoxins. They're
Wow.
also using peptides, so they have like a topical peptide that you can use in the sinus to
Mm.
get it all out of the sinus. But I mean, we've had really good success just using cell core binders. They're a little more gentle. I know some that I have right now a 4-year-old patient. Same thing. When mom brought her in, she crashed and burned. She was totally normal at 2, and then she went into basically like a pandas type reaction. She thought she had pandas, and then they found out that their house was full of mold. So, she was self-harming. She was banging her head, pulling her hair out,
Wow.
screaming, inconsolable, like, psychotic, basically.
Wow. Yeah.
And she told me, well, we just figured out that our house is moldy and we just moved out. I'm like, you have to detox her first. But I mean, first of all, I don't know that it's beneficial to like restrain a child to do therapy. And
Right.
this child would have had to be strapped down. It was that bad.
Wow.
Um, and her doctor, and I'm not sure who the doctor was, they used like 6 weeks of high dose diflucan,
Mhm.
and that seemed to work for them. So I
You-
just saw her after she was working with another functional medicine doctor, which is perfectly fine. Um, and this little girl's she's like a different child. She gave me a hug. She's calm. She's
Amazing.
still not verbal, but now we can actually begin
Right.
rehabilitating the brain.
Exactly. So that's
Right.
kind of the key. So your assessment is totally individual, and you look at all these different markers, and then you
Mm-hmm.
take it from there, basically, depending
Yeah.
on where you
Mm-hmm.
are. And I think that's a big one.
Yeah.
And the other one is heavy metals, right? I mean, that's
Yeah.
huge as well. Big problem
Absolutely.
for
Mm-hmm.
neurological disorders.
Mhm.
Absolutely.
Yeah. So you have your beautiful wife is in your practice as well, and
She
she does
is.
thermography. We're going to have her on our podcast,
That's
hopefully
awesome.
soon.
Yep.
Mm-hmm.
Can you tell us a little bit short, give us a little teaser about what she can do with the machine she has? Because I know she has a very expensive machine,
She
or
does. She has a state of the art camera, and
Ah.
some people, I would say a lot of people are kind of dipping their toes into functional wellness. And particularly a lot of women are becoming leery about all the radiation of a yearly mammogram. And speaking to the primary benefit of thermography is that women with dense breast tissue are often prescribed yearly or even semi-annual mammograms
yeah,
because they're seeing spots, they're seeing things they can't distinguish, and it's a lot of radiation. So thermography is not diagnostic, but it is a way that measuring very subtle changes in temperature, because those temperature patterns are static, particularly in the breasts, in the thyroid. You can look at the carotid arteries. There's some pretty vital structures that are you can monitor the health of those structures through thermography as opposed to using radiation.
Wow. What about for like a
So
colonoscopy? Can she use it to look for polyps and things like that? Or no, it
no,
won't that? No.
no. I mean, it can show that, if the abdominal area is on fire, if it's hyperthermal, um, sometimes you might ask, do you have digestive issues? So thermography becomes almost like a portal of entry into a deeper investigation functionally. But most of the women that are coming for breast thermography, it's because they've already been kind of beat up through mammograms and other things. They're like, okay, I just don't want to do that many mammograms anymore. And you can
Yeah.
effectively monitor breast health with thermography.
So
That's
great.
amazing. Yeah.
It's amazing. And every woman needs to know about that.
Mm-hmm.
Right, Molly?
Oh yeah. Well, I know my mother's experience, like she always goes in and she has the denser breast tissue and they always are like, oh, we need to do a biopsy. And and they put people
Right.
through this whole ridiculous pattern of things that you have to do all the time and constantly poking and prodding. And it's just, it feels, and it's scary for the person going through it because they're like, oh my gosh, do I have, like, they found something and now I got to go back 6 times and da, 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 da. So this
Right.
feels like a little bit more of a like like relaxed way of doing it, and then you can take more precautions
Yeah.
after that. But yeah, it's a
Yeah.
little way less scary.
Yeah. She's and I as well. I mean, I really have always tried to build a community with other practitioners, in the area. I mean, you can't do all things for all people.
Mm.
So whether that's with medical physicians or, with other functional medicine practitioners, or in my case, like with mental health practitioners, I've really made an effort to reach out and kind of build a community, and health coaches as well. We have autistic families. A lot of times when we're talking about cleaning out their pantries, they don't even know where to begin. So, I have a couple of health coaches that I work with as well, saying, look, you need to work with this person. And because
Oh,
it's
nice.
overwhelming. It's an overwhelming amount of things to deal with.
There's a lot
Yeah.
to unlearn. We need to unlearn a lot of habits, and I think that's tricky because people struggle with change. It's like behavior change is one of the biggest issues I think that people face. But when you have
Absolutely.
a child who's sick, it's like you got to do it. You have to be all in, I've seen
Mhm.
I've seen moms. I have a few friends who have kids with issues, and I've seen them go from like soda drinking, whatever, to like they're cleaner than even I am at this point. They're
Right.
like, because they're dealing with a child with an issue, and they almost become health coaches in their own way.
Yeah,
At
of course.
so, yeah.
Right.
Of course. Of course. Um, so looking ahead, what do you see your practice hold? What's for Dr. Leo Hart? Where are we going here? What exciting things do you see in your space? Neurology, chiropractic care. What is out there? What
Well,
excites you?
well, what excites me is this idea of patients for years have asked me, do you know a holistic pediatrician? And I really don't. I've heard there's somebody in Jupiter who's a holistic pediatrician, but I don't really know how holistic they are.
Mhm.
Mhm.
And just to address this issue of this surging population that we're dealing with, I think you have to address it from the preconception planning side of things.
Mhm.
And I think it has to be, neonatal care on a totally different level than what's happening right now.
Mhm.
Um,
Yeah.
and so my kind of dream that I'll just put out there is I kind of have a vision for a truly holistic pediatric practice, or like
Oh,
a
oh,
family health practice that
wow.
starts with preconception planning. It starts with holistic care through pregnancy to reduce stress, to aid in labor and delivery, reduce the chances of C-section birth, maximize the success of lactation and nursing success with the babies, lifestyle intervention for the household, which kind of goes back to the preconception planning. I think this is really where we're going to get families healthy again. I mean, it
Oh,
starts there.
Yeah.
And
100%.
and all the things that go with that, whether that's genetic testing and gut testing for the mom, and there's layers to it, but putting all of that together, because what we see all the time is it's all just kind of all over the place.
That would be a full office in about 5 days, I feel like. Like there's so many people
Totally.
looking for that, and it's really
Right.
hard to find. And I mean, I know that I feel like that's the best time to have someone change their life right before they're about to have a baby, or if they're in the preconception stage. Like that's the best time to get people to really look at their lives, fix anything that's broken.
1000%.
Right. And
Oh.
they're motivated. I remember when I was a new mom, I remember being like, oh my gosh, I've got to get all the, toxins out of the house, and I'm going to only buy these clean baby safe products now. Like you're tuned into that already. So why not, jump in? And I mean, I think so many people,
Right.
I would go.
Oh, I
Yeah.
would so go.
Yeah.
Yeah.
And Dr. Leo, I
Yeah.
wish you were
There's-
when I was pregnant with my first one. I mean, I had no idea. Do you know what I did when I was pregnant with Hugh? With Brandon, he's 17 now. So we lived in London, and I was like on a marathon walk every day. So like I walked like 500 miles a day. Okay. This poor kid, right? And I kind of like starved myself, so I didn't like gain much weight. And this poor kid, and then I drank a bunch of orange juice and grapefruit juice. Okay. And the poor kid was born, he was upside down, right? He was C-section, right? I mean, I had no water left. I mean, it was a mess. I had no idea,
Yeah.
and then he had a bunch of vaccines because I didn't know better. So it's like, I am now on a mission myself. Like I see a pregnant person and I'm like, talking to them. I'm telling them what I did wrong. You do not want to be, look up, know your facts is what I always try and say. Read up on, are you really going to be giving your kid all these vaccines that is like, Kennedy's talking about in 83, what was it, like 7 vaccines? And now it's like, what is it,
Right.
35 or like 70 or something like insane.
Yeah.
Right?
Well, they say that, but you know what they say? They say all truths go through 3 phases, right? It's first you're ridiculed, and then you're violently opposed, and then it becomes regarded as self-evident. But this, I think we're in the violent opposition, because I mean, look, Kennedy, he's labeled as an anti-vaxxer, and he's just saying, where's the data? Show us the data, show us the research, and no one will debate him.
Yeah.
Correct. Well, they understand.
No one wants to talk about it. And it's like, okay. I mean, I had this conversation with a patient just yesterday, and I forget how it started. She was saying, oh, I just said, I was really talking about this Make America Healthy Again, which I'm really apolitical. I'm a registered independent. I just, but it's true. Like what he's been saying all along is like, we can't ignore that we've made our society sick.
Oh,
and it's environmental.
100%.
So, the research is not there because, again, physiology is complex. So there is no study that says vaccines cause autism.
No.
However, in the scientific world, we have to be really careful about that, right? Like there is an association of whatever it might be, hyperpermeability in the gut, hyperpermeability of the blood-brain barrier that's triggered by a microinflammation. So there is research to support that. So we're kind of extrapolating that, but you have to be careful how you say it, because you just, you wind up like, oh, you're just an anti-vaxxer. Well, it's like, no, let's just have a logical discussion about how safe really is this. And even if it's a small percentage of people that are having regressions or their brain development is being altered by something that might be in a vaccine, let's figure out a way to know who those kids are so that we know it's not safe for that kid.
Right. Just actually, that's what I've always said too. It's like, just screen the child before the vaccine, just to make sure, like, are they healthy today? Are they, what if like on the day they get the vaccine, they have they had COVID or they had a flu, and then you're bringing the kid in and then they're having a double whammy of inflammation, infection, and blah, blah, blah. So it's like, just look, spend 2 minutes and assess the child before just like, and most of us know too, that that all, pharmaceuticals come with downsides, but for some reason vaccines have been put in this category of like, oh no, there's no downside, like they're just perfect. Like,
but we know that the reason for that is because they've been indemnified from any liabilities. So,
Correct.
that's the thing, is
Correct.
if they were being held liable, there have been class action lawsuits all over the place.
100%.
And sometimes lawsuits are baseless too, but at least it would be out there. Like, okay, the secrecy, this veil that they have it's criminal, honestly.
It's criminal, totally.
And they hide behind that, saying it's totally safe and everybody needs to do it.
Yep.
And when you're a young doctor in medical school, you're indoctrinated in that.
Yeah.
Correct.
And that's the reality. So,
Yeah.
and back to that concept of a holistic pediatric practice. I mean, there's not a lot of pediatricians coming out of regular medical schools are willing to take that leap,
No, because they're indoctrinated in that if they're going into pediatrics, that's the number one thing they do. That's how you get people in the door for a lot of the time. Yeah.
Right. Exactly.
So that would be a holistic
future.
Yeah, but a holistic pediatrics office would be controversial. That's why it's not done so much because of the vax stuff, right? Because
correct.
No,
correct.
You would be in the ridicule zone, So
no, we're in the violent opposition phase.
Right.
If you look at it, I mean, really, right. I mean, like I said, nobody wanted to debate Kennedy. In fact, they wouldn't let him. I mean, 4 years ago, you could have voted for Jill Stein in all 50 states. Why can't you vote for Robert F. Kennedy?
Yeah.
Everybody's terrified of that guy.
Oh, yeah.
They're terrified.
Yeah.
So instead they blackball him and they sit back and ridicule him on things that are baseless. It's insane.
They wouldn't even let him talk on major media outlets, which is so crazy. He was completely shut down from even speaking at all on like CNN, ABC,
Right.
He's like, this is so weird. That's never happened before. Even like
they have him on Fox News all the time, but again, that's where unfortunately it's become so political. But that's the violent oppositions. We're in this thing. Everybody's got to pick a team, and I don't like it.
Yeah, I'm with you. I'm anti-tribalism. I think all of that is. I'm on this side and I'm on that side, and there's so much overlap. Really, there is. If people just looked, that there is. Everyone really, at the end of the day, if you ask them what their core values are, I think we'd all kind of be like, we want to help our children, we want to eat good food, like a lot of the things are aligned there, but everyone's just that side's stupid, nobody talks, and then it's like, how do we get anywhere with that?
How do we get out of that cycle?
Yeah,
it's so toxic.
Absolutely. Well, on that note, this has been an amazing, very informative hour. We loved what you shared with us, Leo, Dr. Leo. This is wonderful. How can the listeners find you? Where are you? Where are you hidden?
Yes.
And socials.
We're in Stuart, Florida. You can find us at completecare.health or at brainspaceneuro.com. Those are our two. They kind of both go to the same web address. But we're here in Stuart, Florida, and you can just look me up by name.
Do you have an Instagram or a Facebook or a TikTok?
We have a Facebook. It's Complete Care Chiropractic. And I'm so bad at this. It's like we have a Facebook is Complete Care Chiropractic and Wellness. There's also a BrainSpace Facebook page. That's just kind of getting going. And then I do have an Instagram also at Dr. Leo Hart.
Great. No TikTok yet then.
No TikTok. No, talk about it. They're telling me I need to do this, but I have teenagers also, and I'm like, I feel like I'm contradicting myself. Like, you guys stay off of it, but then they're telling me I need to do it.
Oh, I know. I'm in the same, battle.
Well, it's marketing where business is now, so it's kind of
right.
Yeah,
it's hard to stay away.
Yeah, we'll be increasing our social presence just because we're bringing some new people on board. So I can designate that part. But yeah, we're gonna be posting some, and already on the Instagram, actually, we went through some case studies and some clinical successes that we've had, and we'll be sharing more of that in the near future.
Lovely.
Love it.
Thank you so much.
Dr.
great.
Lehman, we really appreciate you and we're so grateful that you exist and that you're helping people. And we hope that all the moms listening to this podcast will go see you if they're having an issue. So thank you so much for sharing.
No, thanks for having me. You guys are awesome.
Thank you so much.
Have a great Friday. All right.
Bye, everyone.
Bye-bye.